My name is Mark Frasier. I'm from the Michael J. Fox Foundation. We are located in New York and fund research to accelerate new therapies for Parkinson's all over the world. Thank you to the meeting organizers for putting on such a wonderful meeting and for inviting me to speak. This talk will be maybe slightly different. I'll share a little bit about how we think about supporting biomarker research at the Fox Foundation through different collaborations and public-private partnerships, and then share some what I think is exciting data coming out of the biomarker landscape in Parkinson's disease. So this is just a quick snapshot of where we see the drug development pipeline in Parkinson's disease. And we've been around almost for 20 years, and it's the most robust pipeline of new treatments in clinical development that we've seen in our lifetime. What's exciting is that they're both treatments going after unmet needs of symptoms that occur in Parkinson's disease, both motor and non-motor symptoms, but also through some genetic discoveries like alpha-synuclein, LRRK2, and GBA. There's treatments in the clinic now being tested that we think might have disease-modifying potential. Now, all of these treatments are going to suffer from the lack of really objective and useful biomarkers for measuring progression of Parkinson's disease, which is why we think supporting biomarker research is so important. So this is just an illustration of, probably it could be applied to any disorder, but there is clearly a pre-symptomatic phase where dopamine neurons are lost, clinical symptoms do not present, and then clinical progression proceeds along with along with the neurons dying. Now, what I don't think is illustrated here is that this is not a linear effect. This is just a cartoon. And what I'll be showing is some data that suggests it's actually, there's some early preclinical changes prior to diagnosis that can be detected that I think are worth pursuing. So the Fox Foundation supports both drug development programs, either in academic labs, biotech, or pharma, but we also address field-wide challenges that are systemic to the field, things like biomarkers, clinical rating scales that can be applied to multiple different drug development programs. And biomarkers are clearly a field-wide challenge. And we've evolved our thinking a little bit. Since our inception, we've always supported biomarker research, but we support now both investigator-initiated research as well as what I would call the ecosystem of building resources and infrastructure to do biomarker discovery and validation. So this includes developing standardized methods and protocols for sample acquisition or understanding pre-analytical variables in certain assays, collecting samples from a comprehensive set of people with Parkinson's and controls to make available for discovery and resources, discovery and validation, and then making those data sets available as a resource for the community. So this just highlights a couple of examples where we've coordinated public-private partnerships to address a specific challenge. On the left is an example where pharma companies and biotechs were developing target engagement markers for the measurement of LRRK2 kinase activity, and there was a need to understand different protocols in peripheral blood monocyte collection and how the protocols impacted LRRK2 kinase activity. So we collaborated with the groups and as well as some academic centers, including one here in Barcelona, to collect samples from mutation carriers of the LRRK2 gene as well as non-mutation carriers and compare the different protocols with the outcome being a LRRK2 kinase activity. On the right is another example, which actually is a small figure, but a huge effort, and you'll hear a little bit more about from Dr. Keurig this afternoon. But we call it the Investigating Synuclein Consortium. So alpha-synuclein, we think, is a really key biomarker. There are different forms of alpha-synuclein that can be measured in fluids. And each box here represents a different laboratory and different group that is prosecuting different forms of alpha-synuclein. And it was really important for us to have the same samples be analyzed across different laboratories in a round-robin format. So this represents a number of different assay platforms as well as sample matrices that are being interrogated for alpha-synuclein. This is another very quick example where we collaborated with a group called the Cohen Veterans Biosciences to compare different platforms measuring inflammatory markers in Parkinson's disease samples. And the results of this bake-off were reported last month at a Fox Foundation meeting in the form of a poster and will be published soon. Okay, so in addition to these targeted questions based on particular biomarkers, we've also supported resources and samples, what I call the cohort ecosystem, to collect data and samples to make available for the research community. The one I'll spend the most time on for the rest of this talk is the Parkinson's Progression Marker Initiative. It's a longitudinal biomarker study. But these other studies are examples where we've collected varying degrees of rigorous data. The Fox Insights study is an online virtual study in 30,000 individuals where patients can participate in the comfort of their own home and report quarterly surveys. So that's patient-reported information. And the systemic synuclein sampling study was a targeted cohort study to understand how alpha-synuclein accumulates throughout different tissues in the same individuals, including colon, skin, CSF, and submandibular gland. But let me just switch to the PPMI study. So the Parkinson's Progression Marker Initiative study was launched in 2010. It was really standing on the shoulders of the ADNI study, if you're familiar with that in the Alzheimer's field. And the goal of the PPMI study was to develop a rigorous, standardized set of samples and data in the same individuals for the purposes of biomarker validation. So this study is now occurring across 33 sites around the world. It's a public-private partnership that includes all of the partners you see here, and we're still adding more. But the real goal is to facilitate biomarker development that can be used in phase 2, phase 3 clinical trials. We now have about 1,400 subjects enrolled in the study. They're contributing a comprehensive data set that includes neuroimaging data, both SPECT and MRI, extensive biosample collection, including spinal fluid, blood, urine, DNA, RNA, as well as both movement disorders or examinations, clinical exams, and non-motor clinical exams. It includes subjects both with Parkinson's disease and without, so healthy controls, as well as individuals that are at risk for developing Parkinson's disease, either based on a genetic mutation or clinical symptoms such as REM sleep behavior disorder. So this is a very deep, comprehensive data set following standardized protocols for quality control and quality assurance that occur as the data is being collected. And this slide illustrates that if one were to enroll in this study, one would have at least 7 lumbar punctures in the first 5 years of the study. And we've actually been successful. In 2010, this was launched. We've had about 90% retention. So this is a committed group of individuals with a very robust data set. So these are some of the data. I'm going to first show you some imaging and then get to some of the biochemical markers that are being interrogated. But this data is very interesting, was just recently reported, and it's somewhat of a busy slide, but I direct you to the right-hand graph, which shows the arrows pointing to individuals that carry the GBA mutation, but upon getting a DAT scan, which is an image of dopamine neuronal tone, visually they look normal. So they carry a mutation. They don't look like they have Parkinson's. They have no symptoms, no dopamine loss. But if you look at the imaging, if you actually quantify the signal and do striatal binding ratios, you see an increase in dopamine and in DAT scan, and that's increased relative to controls. So it means these individuals are on the spectrum most likely to develop Parkinson's disease at some point. And interestingly, the dopamine levels go up in individuals carrying the mutation. There is a slight increase in individuals that have the LRRK2 mutation, although it's not statistically significant. So that's indicating that there are early changes prior to developing symptoms of Parkinson's that we could detect as biomarkers. So earlier we talked about alpha-synuclein. Alpha-synuclein can be measured in spinal fluid. These are data looking from the PPMI study that show in Parkinson's disease in red, there is a lower level of total alpha-synuclein in spinal fluid compared to the controls in green. However, and this has been reported by multiple different groups on multiple different platforms, but however, if you look longitudinally, it doesn't seem to progress with the course of the disease. Interestingly, in individuals with REM sleep behavior disorder in black and individuals that have hyposmia as well as positive DAT scan, alpha-synuclein does seem to be lower. So this is prior to developing any symptoms of Parkinson's disease. They just carry risk factors for PD, and they have lower alpha-synuclein. So I looked at the agenda and I felt obligated to include a slide that reports on neurofilament. These are data that were generated by Britt Mollenhauer and colleagues at Biogen on the PPMI study. Again, in the same individuals for which we have CSF alpha-synuclein, dopamine imaging, MRI, et cetera. And what they show is it has been reported in the past. These data are posted on Biomarker and has been submitted, which is Parkinson's disease subjects on the left in blue have this is serum neurofilament. They have a higher level in neurofilament, serum neurofilament compared to controls. And if you look at the change over time, they actually have a more rapid increase change over time relative to the control, suggesting that it could potentially be a progression marker. Interestingly, it also correlates nicely with the clinical scales in the UPDRS function. So we think there might be promise, if not using neurofilament as a single marker, but combining it with other markers like alpha-synuclein. What's interesting is that PPMI's goal is still the primary goal is still biomarker validation. But with this comprehensive data set, we've been able to understand the human disease better. And this is through some more discovery activities through targeted proteomics, whole genome sequencing, and RNA sequencing. So these are some examples where we've collaborated with other industry groups to either do targeted assays on the PPMI sample. So on the left is using the Roche Neuro Toolkit, doing targeted candidate measurement in spinal fluid. Those data are being generated right now. And on the right, using the SomaLogic SomaScan platform in collaboration with Novartis, we're going to interrogate 5,000 proteins in the spinal fluid of individuals with Parkinson's and at risk for developing Parkinson's. So this is going to be an enormous treasure trove of data from which novel markers and novel assays may emerge. I mentioned this earlier, but I want to underscore that all of these data are available currently. We have weekly uploads of the data. You can go to the PPMI website and request access and receive access to the data, usually within a couple of days. Another round of data that has been uploaded that will complement the whole genome sequencing is really deep RNA sequencing from the blood samples of these individuals. Again, both with Parkinson's disease and healthy volunteers and individuals at risk for developing Parkinson's. So this is a schematic of some of the data that was just uploaded into the PPMI website. It's really deep RNA sequencing. We already have the whole genome sequencing and some of the candidate protein markers. So we're excited to start interrogating these data. If I look ahead and I kind of see what's coming down the pike in terms of promising markers, there's been a lot of work looking at so-called alpha-synuclein seeding. The concept is that you can take a specimen, a CSF specimen, introduce a synthetic seed, and propagate aggregates to occur, and you can visualize this propagation using fluorescence or other techniques. And what's interesting is that there's a couple of different platforms, one called the RT-Quick platform, another called the PMCA platform, both conceptually the same, using slightly different technologies. We supported a study to analyze the same samples in the two different platforms, and you can see the sensitivity and specificity just comparing people with Parkinson's and controls. It's remarkably consistent across the different platforms. So the PPMI samples are currently being analyzed with this platform, to look to see if changes occur over time and in individuals at risk for developing Parkinson's. We're also about to expand PPMI. So I mentioned there's about 1,400 subjects around the world that are participating in PPMI. We're expanding it to PPMI 2.0. Our goal is to recruit an additional 3,000 individuals, to enroll individuals. We've demonstrated a feasibility, a proof of concept in the PPMI study that individuals at risk for Parkinson's can be recruited and enrolled into a study like this. So PPMI 2.0 will expand on this, enrolling individuals in an online study, and then as you build up, you get closer and closer to a diagnosis and increase in your risk for Parkinson's, we'll bring those subjects in for more sophisticated examination. So I'd like to end just to highlight a publication from this year that I think is the way of the future. Through the deep, rigorous data in PPMI, there have been machine learning approaches to try to, in a data-driven way, identify the different subtypes of Parkinson's disease. So this publication used multiple different methodologies and machine learning approaches. And on the left, you can see this LSTM methodology that differentiated 3 different subtypes of Parkinson's disease based on the clinical, molecular, and imaging features. So this is early days. And the translatability of this, I think, is still limited. But as we generate more data, this is where I think the era of precision medicine is going, to identify individual subtypes and treat them accordingly based on the particular subtype. So I'll just end by saying I think this is a really exciting time in Parkinson's disease biomarkers. It is most likely not going to be a single biomarker, but multiple different biomarkers, and coupled with multiple different modalities that I think will identify individuals earlier and then guide specific treatment strategies. I'd like to thank the patients and the research volunteers that participate in these studies that we fund. It's clearly a rigorous effort. I'd like to thank the sites that are participating in these studies. This is also a big site burden and a lift for them. And I'd like to thank you for your attention. Thank you.